I always wanted to know that if it's true. Does gum disease have something to do with the heart?
It's some bacteria directly correlated to having gum disease. 2 minutes is the brushing time in your mouth.
2 minutes?
Yeah. Whitening that I specifically really love that you can do at home. Everything at the end of the day is a chemical, right?
Are we not done yet?
We're not.
Welcome back to the Jadu podcast, broadcasting from New York City, where we believe in chemical-free world and more natural approach to beauty and wellness. Today we are joined by Dr. Sheila Monahemi.
Hi everyone, my name is Dr. Sheila. Welcome to my office.
Dr. Sheila is a leading cosmetic dentist at Sutton Advanced Cosmetic Dentistry in New York City. She is known for her gentle approach and exceptionally natural smile transformation. Dr. Sheila graduated with honors from NYU College of Dentistry. Sutton Advanced Cosmetic Dentistry is known for their Goa practice for celebrities like Nicki Minaj, Ashanti, Fat Joe, Idris Elba, DJ Khaled, and much, much more. Welcome, Dr. Sheila, to our podcast. Let me start by telling you that if I had to ever work on any of these people I just mentioned, it would be a disaster because I would be so starstruck that I would probably drill the wrong tooth or the chin or the cheek. I don't know. But honestly, you are so impressive for such a young woman. And I'm so excited to have you here and dive into the world of cosmetic dentistry. Can you tell us what makes your practice different from a traditional dental practice?
Our practice is different from a traditional dental practice because we're not a one-stop shop. We are a very niche concierge type of dental practice. I look at each patient, not just their mouth or one tooth or something they have pain in, but it's an overall wellness scan being done on every person, really everything that you are concerned about being taken into account and being treated as a whole, not just as a tooth.
So what is your philosophy of creating the most natural smile?
I don't use the textbook, oh, each tooth should be this size or this shape. I sit and I get to know someone and I take tons of pictures. I always joke with them, you didn't know, but this is your modeling day. And we are taking pictures. We are talking. I want to see them moving, where their lip is, what their face looks like, how they're excited, what's their personality. Are they a big personality that needs a huge smile? Are they need a more subtle smile? All these things come into account. And then I have scans of their teeth. So I basically have all the information of each person in front of me that I can now use when they're not in front of me to design their perfect smile.
The veneers mostly, right? Yeah. So each one is, of course, different, and each person wants a different type of veneers. And
no two smiles in our practice are the same. Shape, size, even to the edge. Is it going to be more round? Is it going to be more square? Is it going to be softer? Are we going to show more translucency for this patient? Are we going to give a younger look? Are we going to give a more mature look? The list goes on and on, in color, in brightness, in saturation.
Yeah, but let's say someone comes and tells you, I want it to be as white as possible, which I'm sure a lot of people come and it really doesn't look that.
We get both. We get some people saying, I want no one to know. And I get some people saying, I want everyone to know. Really? There's a whitening that I specifically really love that you can do at home. So you have whitening trays and you can sleep with the gel in your mouth, gel in the tray that goes onto your teeth.
Now you guys have a bunch of celebrities all the time that come to you. What do you think, in your opinion, draws people to your practice?
Trust, number one. Treating them like they're any person on the street and not being shocked that, oh, you're a famous person. And also reputable work that has lasted. There are people with teeth in their mouth that it's been well over 20 years now and it's perfect. So that just speaks for itself.
We hear so much today about going chemical free. skincare, hair care. And now we hear about dentistry. What does chemical-free dentistry means to you?
Chemical-free, I think that sometimes can be a little bit of a buzzword because everything at the end of the day is a chemical, right? But if we're talking about things that are abrasive, things that are harmful to our oral microbiome, things that are harmful to our teeth, these ingredients are present in oral care everywhere. In toothpaste, in mouthwash, on floss even.
Can you explain for people who don't know what does mouth microbiome means?
Sure. So the same way you have a microbiome in your stomach, gut health, right? So I like to explain to my patients as a rainforest, and you plant things and you have to feed the soil and you want things to be in a healthy level. That's also in our mouth. We have tons of bacteria in our mouth. Some that are good bacteria and some are bad bacteria. Some bacteria directly correlated to getting cavities, some bacteria directly correlated to having gum disease or having inflammation in your mouth. So we all have saliva, and what saliva does is it rebalances the pH of your mouth. Even a sip of coffee, unless it's water or any food that goes in your mouth, automatically that pH is decreasing because you are sending signals to your stomach to start breaking food down or breaking anything down, and you're creating a super acidic environment in your mouth. Then your saliva comes back, buffers it up, and brings that pH back up. But if the oral microbiome is not balanced and we have a problem in that pH level where either it is not able to rebalance, it leaves place for things that we don't want to grow and things that we want to be killed.
Do you agree with people testing their microbiome?
I love it. I love it. I come from a camp of more information, the better. I love to learn about myself and my patients. And there are some amazing oral microbiome tests out there, especially someone that is super high caries risk, or like they're getting tons of cavities and they're like, I'm doing all the things you're telling me and it's not working. You know, doing a simple swab and getting their profile of what's the oral microbiome in their mouth is amazing, because then we can kind of change their regimen and products and do that swab again. And it's not invasive at all, and see how we can make that shift into what's happening in their mouth.
Does the gum has I always wanted to know that if it's true.
Yeah.
Does gum disease have something to do with the heart?
It's directly correlated to your heart and to your brain. Oh. Because there's tons of testing that have been done in people that have heart disease, that the bacteria that's found is the same bacteria that is found in high levels in your mouth. And if you think about it, it's what you're swallowing every day. So this is where it starts. It's traveling. You have an imbalanced gut. A lot of times it's starting from your mouth being imbalanced because you're swallowing that every single day.
So I think that most people don't know that the chemicals inside the regular toothpaste or mouthwash. Yeah. In your opinion, what is one thing that they should be wary of?
So toothpastes, you're looking like SLS, parabens. You want to find something that's like SLS free, paraben free.
What is SLS? So for people who don't know.
Sodium lauryl sulfate. So it's a very harsh abrasive, and this is equal to what bothers me in a mouthwash. Is a mouthwash that has alcohol in it. Right. Mouthwash with alcohol in it is so drying to your mucosa. It will give you, someone that's using this regularly will almost give you the dryness of a mucosa of someone that is smoking constantly. It's the same thing with these toothpastes. When it's too harsh of an ingredient that's killing everything in your mouth, you don't want that either. So patient concerned with having a more natural toothpaste, I would tell them to look for a few ingredients. One, we always want something remineralizing in the toothpaste, which is what fluoride was doing, but now we have its new best friend called hydroxyapatite. So you'll see in a lot of toothpaste hydroxyapatite and nanohydroxyapatite. You're looking for something like xylitol, aloe, neem, green tea. Xylitol, it is a sugar alcohol that is very microbiome friendly. It's actually going to help you to not get cavities, and it's also going to help you to keep a really healthy microbiome in terms of the bacteria there.
Talk to me about baking soda toothpaste. And what do you think about that?
I don't mind baking soda in the right amount. It's actually good for your mouth because it increases the pH, but it can be super abrasive. So if it's too much baking soda, then okay, you're increasing the pH, but you're scratching the surface of your teeth, and we don't want to do that either. Because the other thing about this bacteria is it loves sticking to a rough surface. So you're scratching your enamel, that bacteria loves to stick on there. You want smooth teeth, high pH. That's like the name of the game. And what happens, a lot of times you'll see in like a natural whitening toothpaste, that it's whitening from baking soda, whitening from charcoal. So think about like a metal scrubber on a pan that you're using, or a face cleanser that has beads in it that's very abrasive, that feels super drying after. That's how that's working. Because what you end up doing is wearing away your enamel. Your teeth over time, in the beginning they look white and it's, wow, this is amazing. This toothpaste really works. After a couple months, your teeth start thinning out. They start looking gray and see-through and they actually start looking yellow. And the yellow now isn't from the coffee you're drinking. The yellow is from the inside of your tooth is yellow. And now that's showing through because that outer layer of enamel is not thick anymore. And that, when you get to that point, you can't whiten your teeth anymore. You're looking at veneers.
Now, you drink coffee and tea.
Yeah.
So what do you do right after you go and brush your teeth?
No, that's like the opposite of what you want to do.
It's the opposite of what you want to do. So what do you do?
After you drink it, I'm going to give you a couple tips. One, it's better to drink it, like not to take a sip, one sip every half an hour and have this cup of coffee with you from 8 in the morning till 12 in the afternoon. That's like probably the worst thing you can do.
That's what I do. Oh God.
That's not good for many reasons, but especially for staining and what's happening in your mouth. But drink your cup of coffee, drink it quicker, like still enjoy it, and then drink a glass of water after. Drink a glass of water you're gonna even just swish around your mouth, and you can spit it out, you could swallow, whatever you want to do, but that rinse out will make a huge difference.
That's all I do. I have my cup. That's my only pleasure.
But the reason why you don't want to, let me drink coffee and brush my teeth right away is because when you drink coffee, it's super acidic, again.
Yes, of course.
And so you're actually, like, your enamel is weak in those 15-20 minutes after drinking coffee. And if you go right away and start brushing your teeth, your enamel's at a weak point and you're actually hurting it even more.
What is oil coconut pulling? And do you agree with it?
I don't know if you ever tried it. Have you?
No, I don't. No, I never did.
So I've tried it because I'll try everything that has to do with your mouth for my patients. I mean, you're doing it twice a day. You're sitting there swishing for 2-3 minutes. It's really tiring. And I think the feel is absolutely disgusting. It's gross. Yeah. And the result to me isn't big enough to go through that. Okay. So, I mean, I have patients that want to do it. Okay, it's not harming you. So sure, go ahead and do it. But if you think that's going to be what saves you, like, definitely not. And to be honest, most probably that small bacterial load that you're seeing decrease is from swishing for 2 to 3 minutes. Like, if you swished with water for 2 to 3 minutes, you'd see that also. You're just moving things around your mouth for long enough that it's, and spitting it out, you're gonna get obviously a little bit of a decrease. Is it from the oil or coconut oil? I don't think so, but that's just my educated guess.
Right. Toothbrushes, electric or just a regular toothbrush? What does Dr. Sheila like?
I love electric, all the way, for a few reasons. I, first of all, love an electric toothbrush with a pressure sensor on it. So it means it has a a light, usually at the top of the brush, like the junction of the brush to the handle, and it will be red if you're pushing too hard, and it will be white if you're brushing with the correct amount of pressure. I also love it because a lot of the electric brushes now have these little like timers in it, so like it will like beep every 30 seconds or it beeps after the 2 minutes, so you know that you spent the right amount of time, because 2 minutes is the brushing time in your mouth.
What? I didn't hear that part. 2 minutes?
Yeah. 30 seconds, 30 seconds, 30 seconds, 30 seconds.
Huh? Really? Yeah. So tell me about Dr. Sheila's routine of evening routine and morning routine.
Well, Dr. Sheila obviously does the most. So we love a tongue scraper. Our tongue holds so much in the little crevices, and you'll be amazed by what comes out by scraping. I've actually found people that have said they are getting sick constantly and they start tongue scraping, they get sick less too. You're cleaning out, you know, mucus and like all the stuff that's holding bacteria on your tongue. And then we are flossing. I love an expandable floss because they're thin, and so it fits nicely between your teeth, but it hits the saliva and it kind of expands like a microfiber, and it really catches all those little things in between your teeth and cleans it super nicely. So it used to be like a waxy floss people loved. I hate those. But a nice expandable microfiber floss is amazing. Then we are brushing our teeth, and finally using a mouthwash.
You do that in the morning and at night, or only at night?
The mouthwash I like to do morning and night, because at night it's before you go to bed, super protective on your teeth, especially if anyone wears a retainer. The retainer that's covering your teeth, sometimes it doesn't, again, let saliva reach those areas to keep it cleansable. So the mouthwash is super protective. And in the morning, I like to do it because if I'm about to go have a cup of coffee or eat something or drink something, again, I've kind of just raised that pH back in my mouth. I'm like starting at a good place.
You know what I really wanted to ask you also? It's like, what is exactly mouth pH? And how is that? Is it what you eat that, or is it genetics, or is it like you're born with certain pH? Or
the pH comes all from your saliva. So either it's acidic or it's basic.
It doesn't come from the stomach?
It can. So you have a diet that is, for example, this is why.
Like people that have acid reflux.
Yes, acid reflux, anyone that suffers from bulimia, things like, or anyone that has thrown up a lot, because their mouth is so acidic, I will always see their enamel is super thin. They're like totally just eating away at their teeth. So what acid does is when the environment's acidic in your mouth, it's just totally eating away at your enamel. It's making it super weak. It's breaking it down completely. That's what's making you get a cavity. That's what's making your teeth be thinner. That's what's making either sometimes from the back of your teeth or the front of the teeth feel very thin and see-through and very sensitive. Part of it is your genetics. Part of it can be what's your saliva makeup. Part of it can be how much saliva are you producing. Some people don't produce enough saliva, maybe because they're taking a medication that reduces saliva intake. It's actually a side effect of more medications than you would think. And we're in a day and age now that 10 patients I'm seeing a day, let's say of the 10 patients I'm seeing a day, there's not one of them that isn't taking something.
Is there a connection between the pH, and that's kind of like a difficult question, but between the pH and people that get tongue cancer?
My educated guess on that is yes, because again, what's happening is your mouth has a few different types of mucosa. The mucosa is very thin, so it's easily penetrated. It's why people that are smoking or have use those patches in their mouth, like nicotine or whatever. Like you are creating an environment for ulcers, you're drying out the tissue there, and it allows for these bad cells to thrive.
So again, it has something to do with chemicals.
Totally. It's for sure part of the story. Your teeth last longer. Everything to last longer is good oral hygiene. So it's brushing with an electric toothbrush, it's flossing, and it's getting your cleanings.
So happy that you joined us today.
Thanks for having me.
We have a little surprise for Dr. Sheila. It's her birthday, and we are so honored. Birthday to you. Happy birthday to you.
Oh my gosh, thank
Happy
you so
birthday,
much.
dear
Wow,
Sheila.
Birthday to you.
Thank you, Elisabetta. And Elisabetta is our top Jadu model that we adore and love. Happy birthday, Sheila June. Wishing you happiness and love. And I wanted to share this with you. This is the magic drip. What Jadu means, which many people have asked me, Jadu is magic, in few languages. It nourishes your scalp, and it does
So many of my favorite ingredients.
Yeah, it does wonders for the scalp, for sure. So we would like to gift this to you.
Thank you so much.
To our viewers, wishing you all a very happy and healthy new year. And if you liked our podcast, we would love it if you subscribe to us. We would love to have you, and we'll see you next time. Thank you so much.